The shape of your nose is one of the most important features in facial appearance. Plastic surgeon Dr. Stephen Pincus of the Morrow Institute in Rancho Mirage tells us that the nose should be a work of art.
Initially, rhinoplasty was basically a reduction in the size of the nose, and I do a lot of revisions, so a lot of what I do is correcting that and actually augmenting the nose. But nowadays, the techniques that we use are trying to make the nose look natural, and natural doesn't always mean making it look smaller. It's basically making it look more aesthetically pleasing and in better proportion with the rest of the features of the face. And that can be making it larger or smaller. But nasal surgery may be the single most operation that really changes the way a person looks. It can. Of course, you can make it so that it's not as dramatic, not that dramatic, but just removes a little defect that bothers them. This is a slightly older lady who, with regard to her nasal surgery, had what we call a dorsal hump deformity. And at least on profile, you can tell that the hump or the bump over her nose was reduced. In this particular patient, she had a depression over the tip of her nose, a so-called supra-tip depression, as well as a bump at a higher level. And most patients, as they get older, don't want to have too much of a dramatic change, but they want to have a cleaner look. Not a terribly dramatic result, but in her mind it was. You can make a small change on a patient, and it can actually have a fairly dramatic change in their mind, because self-confidence is basically related to their self-image. And it can be just even a little bump on a person's nose, or the tip of their nose, which in their mind appears to be drooping. That can be something that has always been a thorn in their side. And by correcting that, you can really change their self-image. Well, her main complaint was that she didn't like the bump on her nose. And in this patient's case, what I had to do was I had to remove the bump, as well as stabilize and increase ever so slightly the position of the tip. She was a very satisfied patient. As a younger man, I used to sculpt a lot and taken a lot of sculpting courses. And actually, they even give courses in art to doctors. These courses appear once in a while to help sharpen their sense of aesthetics. Generally speaking, the best surgeons that I know who do cosmetic surgery do have an artistic sense anyway, and whether it's something that they're born with or something they develop, it's really hard to say, but you really have to know what looks good, basically. I think it's satisfying in that, as an artist, not only do other people appreciate your art, but the art object itself appreciates itself. So you get a double gratification.